Okay, so we are on London's Harley Street going to get the skull jaw x-ray called a lateral ceph, and that is going to show how the jaws for Dipali, say hello Dipali,
hi,
sit within her skull structure. So we're going to go in, have the x-ray done, and then we'll analyze how it all looks and what it means for her issues that she's been having. Okay, here at a former architectural home in London, going to CT Dent now. Dipali's just in, ready to have her lateral x-ray, and we're going to step out of the room now while it moves. Okay, so I've got the jaw x-ray back for my sister. The x-ray in question is this. It's a lateral ceph. It shows me how her jaw sits in relation to her overall skull, and it gives me an outline of her soft tissues, her lips. Now, what's more useful than this is the actual measurements that we can get from this. So if I actually just show you what that looks like, all these measurements give me an indication of what's going on with her. So first of all, this figure here, 106 degrees, that's actually the angle of her top front teeth, her incisors. These incisors are at 106 degrees. What this figure should be is 115 degrees, which is like that. So what that means is that these top teeth are actually severely pulled back. And that's happened because her top teeth were extracted and then everything pulled back with braces. And as a result, her front teeth have done that. Now, another thing I want to look at is this, the normalised DLM. The normalised DLM is a figure that gives me the size of her lower jaw, this here, in relation to her overall skull. And this 11.3 figure is actually normal. So her lower jaw is actually a normal size. So the question is then, why is she getting all these jaw joint issues up here? And the answer is the top teeth. Because her top teeth were just pulled back for extractions and braces, her lower teeth, which wants to be here, have been pulled back like this. So she was here and they've done this. When the lower jaw is ramped back, the jaw joint up around here gets compressed. And when you get compression in the jaw joint, you get all these pains that she was getting, which was headaches, tinnitus, so ear problems because there's some ear nerves around the area. Her jaw can't open as much, clicking pain, headaches, and also she was getting a narrow airway, so she wasn't able to breathe through her nose as easily because her tongue didn't fit her mouth, so she was getting poor sleep from mouth breathing. So really the diagnosis is that her upper jaw has been made smaller from previous extractions and braces to retract everything. That's then pulled her lower jaw, which is actually normally sized, back, which has then compressed her jaw joint, giving all these problems. So what's the plan? The plan is that I'm first of all going to get an MRI. It's not an X-ray. It's a different type of image of her jaw joints to see how much damage there's been. Then the second plan is to get a custom-made gum shield, which will just hold her lower jaw slightly more forward. She'll wear that for a few weeks. And the reason I'm doing that is to just check if holding her lower jaw more forward decompresses the joint and relieves all of her pain. If that confirms it, then the last stage is jaw expansion of the top jaw. What that means is that we're going to get the top jaw expanded outwards, which will give her a wider smile, but most importantly, it's going to expand her top jaw forwards to give back the space that she lost when she had extractions. And when the top jaw goes more forward, the lower jaw naturally will move more forward, and that will give her relief from the jaw joints here. And I'm going to carry out this expansion with a slow jaw expansion process because you get these same benefits of growth at the back of the jaw and at the front without the trauma that things like MARPI gives you. And then we're going to finish up with straightening. So the end result is that she'll get a wider smile, she'll get relief from her jaw joints, and she'll get a better supported lip and face profile with room for her teeth to fit, which reverses the effects that extractions and braces have given. If you found this useful, please like and share and comment if you've got any questions.